Hello, everyone. Thank you for being here. My name is Schmidt Raluca Maria, and today we'll explore what happens when symptoms disappear after therapy or in therapy, but clients want something deeper when healing becomes a doorway to transformation. Beyond functional to authenticity. Usually, therapy has two levels, if we are lucky. First level focuses on symptoms, relief like anxiety, depression, panic attacks, and so on. And the second level goes deeper to the root causes of these symptoms, maybe to childhood trauma, to core wounds. Most clients stop when they reach full healing, either by eliminating symptoms or by healing the deeper root cause. But sometimes, after both symptoms and causes are addressed, clients feel a deeper thirst. They ask themselves, who am I beyond the pain? What's my purpose now that I am healed? Or what was I supposed to learn from this pain? I believe this is a third level where healing becomes a doorway to transformation. This gap between functional recovery and authentic living can be the start of a real awakening. In this presentation, I draw from three theoretical perspectives, which I'll briefly list here and explore further in the next slides. The first one is Posttraumatic Growth by Tedeschi and Calhoun, showing how people can grow through crises. The second one is Spiritual Emergence and Spiritual Emergency by Christina and Stanislav Grof, distinguishing between spiritual awakening when it becomes overwhelming. And at this part, I will do differentiating process between spiritual emergency, and psychosis. So we will spend more time on this part. The third one is Therapeutic Presence by Geller and Greenberg. They highlight the role of the therapist's presence in supporting transformation, and this framework guides how I understand and support deeper healing processes. And we'll start with the first one. Tedeschi and Calhoun in 1996 described the phenomenon of post-traumatic growth. After major trauma, people don't just recover, they tend to grow. They find new meaning, deeper relationships, spiritual connection. Therapy can help this happen. And I have an example here, a client who started meditating daily after a serious illness. The trauma became his spiritual awakening. Of course, doing therapy and spiritual practices together. Stanislav and Christina Grof in 1989 introduced the concept of spiritual emergence and spiritual emergency. The first one, spiritual emergence, is a natural awakening that happens gradual and is manageable. The spiritual emergency is when the process becomes overwhelming, like a crisis. I've seen clients after losing someone having intense visions, intense dreams. Our job here is to recognize whether it's pathology or it's a process of transformation. And I have drawn from different research sources some essential criteria that can help us differentiate between these three conditions. The first criteria is the control one. In spiritual emergence, the person stays in control. They can manage their experience. In spiritual emergency, they start losing control. It becomes overwhelming. And in psychosis, there is severe loss of control. So the difference is quite visible for a clinician or a therapist. The second criteria is daily functioning. In spiritual emergence, life goes on pretty normally. In spiritual emergency, their daily life gets disturbed temporarily. And in psychosis, severe problems appear with basic functioning, work, relationship, and even self care. A third criteria is reality contact. This is crucial. In spiritual emergence, they know what's real. People can make this difference between imagination and reality. In spiritual emergency, they have partial contact. Sometimes they are with us, sometimes they are not. And in psychosis, they lose touch with shared reality. The fourth dimension is the duration. How long does it last? In spiritual emergence, it unfolds slowly over months and years. In spiritual emergency, it's more intense but shorter, like days or months. And in psychosis, it varies. It could be brief episodes or chronic conditions lasting 6 or more months. The final criteria is the outcome. In spiritual emergence, the outcome leads to growth and healing. In spiritual emergency, the outcome has transformative potential if we support it right. And in psychosis, they need medical treatment. The key question we're always asking is this person growing through a spiritual process or do they need immediate clinical intervention? Of course, there are additional criteria we can consider for a more comprehensive assessment, like the context it occurs in, the nature of the experience, how well they can integrate what is happening, and their level of distress. These are all good criteria to explore. But these five, the main five I've talked about, usually give us the clearest diagnostic picture. There are some critical overlaps that create diagnostic difficult. Research shows a striking overlaps between psychosis and spiritual emergency. Both involve non-ordinary states of consciousness and unusual perceptions, hearing voices or visions or trance-like states. In fact, the DSM-5 positive symptoms for psychosis, they mirror mystical experiences described in sacred text. At their core, both reflect a disruption of the normal self system. So both have vision, voices, ecstatic trances. This overlap creates diagnostic challenges. Criteria are culturally shaped. So, what one culture sees as spiritual intuition, another may label as schizophrenia or bipolar disorder. For us as clinicians, the key question becomes, are we looking at illnesses or the beginning of transformation? What are the limitations and considerations? When we talk about differentiating between psychosis and spiritual emergency, there are important limitations to keep in mind. First, like we said, the symptoms overlap that make diagnosis very challenging. The context of religious delusions, so what people are visualizing or hearing or hallucinating, is rarely enough to tell us whether we are dealing with pathology or a spiritual process. That's why a holistic assessment is essential. We need to consider the client's life context, their personal history, and their current level of functioning, not just the presence of an unusual experience. Equally important is specialized support. Without it, there is a real risk of pathologizing what could be a normal and even transformative spiritual experience. And finally, some methodological notes. The distinction is still being developed in the literature. We need more precise diagnostic criteria and more empirical research to help us navigate these complex cases with greater clarity. The third theory that I based my presentation on is the therapeutic presence, and I think this is very important because it's the way we support our clients by being fully present with them. And it has three important parts we as clinicians and therapists need to take in consideration and act on them. The first one is preparing ourselves through meditation and reflection, if possible, daily. The second one, staying receptive while grounded. And the third one, creating deeper connection that supports real change. So, being authentic in our life and in our practice. Here are some examples of moments that open the door and make clients ask, is there something more? There are many triggers that open this door, like health crises and illnesses, loss, existential questions, spiritual crises. The pattern is the same. After symptoms improve and deep root causes have been addressed, deeper questions emerge. Let me show you how to recognize when this is happening. First signs are the questions that appear. The questions change from how do I stop anxiety to who am I beyond this pain, or what's my purpose. The second sign is clients start having spontaneous experiences. Like, for example, a client of mine with hypochondria started meditating after anxiety ended, and this began for him a process of awakening and connecting with the spiritual. Another client began having meaningful dreams after losing his mother. Lucid dreams, dreams that tell him the future, and felt the presence of his mother and communicating with her. That was a nice process to support and witness. The third one are synchronicities. They appear more and more, and Jung says that this happens when the unconscious becomes conscious. And I would like to share here an example, a synchronicity that happened to me these days when I was working on this presentation and researching it. One of my clients had a session after 2 weeks of pause when she was recovering after a surgery. In these 2 weeks, she could not work, she could not read, she could not watch TV shows. So she had so much time to think about herself and what happens in her life and why things are happening this way. And in the end, it led her to the question of who am I? So I was very happy that in the same time I was preparing for this presentation, these questions appeared from a client of mine. It was a very nice synchronicity. The fourth sign is that for some people, normal life feels empty, even when functional. They say, I have everything but feel hollow inside. I feel an emptiness. How can we support our clients in these periods of their life? The first point is to validate their experience and do not pathologize it. Afterwards is, if they haven't done any spiritual practice, to introduce them to simple practices like 5 minutes breathing exercises and not 30 minutes meditation. It would be too soon. The next step is creating safe space for exploration. So let the therapy room be a safe space for them to open up and explore what happened. And the last one, but one of the most important one, is monitoring the functioning of the client. If they are sleeping well, if they are eating, if they are grounded, if they can go to work and be functional at work. If not, we must ground them first, and this becomes our priority. What are the ethical risks and challenges? We need to have ethical boundaries, that is, for example, not imposing our own spiritual agenda on our client. We follow the client's lead. Know our competence limits, refer to spiritual mentors when needed. So, admitting that we have limits and our competence has limits, so we need to refer. And then prioritize safety. This is really important again, grounding the client if functioning is deteriorating. What are our professional development and practices? We need to keep learning about spiritual development and have our own practice. We can guide where we haven't been. We need to get supervision or a peer consultation. We need to maintain boundaries. We need to watch for spiritual bypassing when clients are using spirituality to avoid real issues. And for therapy, for the process, it is essentially we're expanding our definition of healing from symptoms management and cause resolution to human flourishing in all its dimensions. We need also to do long term follow up for integration with our clients. In conclusion, some therapy stops at symptom relief, good therapy addresses root causes, but what if there's a third level from healing wounds to discovering who we truly are beyond them and becoming awakening? Symptom relief can become the doorway to inner awakening. Our role as therapists is recognizing these threshold moments, supporting the process, and maintaining wise discernment. I leave you with this final question. What happens when therapy becomes about flourishing and not just fixing? What if our clients' greatest symptoms were actually their greatest callings trying to emerge? I believe this is the invitation of our time to explore our understanding of what it means to heal and what it means to be fully human. Here is the complete bibliography of this speech and research, and I want to thank you all.